The Michigan hospital system says it's taking new precautions amid an uptick in flu cases. The Detroit Medical Center says positive tests in the ER increased 21% over Thanksgiving week. Now the hospital is restricting visitors, and all its hospitals and other health systems are expected to do the same. ABC's medical correspondent Dr. Darian Sutton's here for more on that in today's checkup. Dr. Sutton, England is seeing a sharp rise in flu cases because of this new strain. They say cases are 10 times higher than the same time in 2023. And Europe's usually a bellwether for the U.S. So what does that mean? What are doctors doing with that information here?
You're absolutely right. It is a bellwether for what we can expect during this flu season. What we see abroad is what we should prepare for now for this flu season. And as you said, England's numbers are 10 times higher, likely associated with this new strain called subclad K, which is a strain of what we saw last year. The important factor here is that that strain appeared after the development of the flu vaccine, which increases the risk and the concern for reduced effectiveness. Now, what we're doing here is preparing for the worst, essentially. In the emergency room, we're stocking up on supplies, testing, protective equipment, making sure that we have surge plans in place, paying attention to bed capacity, because, Diane, during the winter, that often becomes a problem. Many patients admitted to the hospital staying in the emergency room increases crowding and slows down the transit. And then also encouraging prevention, especially for our high-risk patients, those who are over the age of 65, those who are pregnant. And then the highest group that we're seeing right now in terms of the numbers are children. So encouraging parents to talk to their providers and their pediatricians about vaccinations.
You work in an emergency room in New York. What are you seeing at the ER?
Right now, it's very early, and I would have to say that I use that experience kind of as a barometer of how I navigate in this city. Right now, we're seeing early illness of flu-like symptoms, sometimes coughs, sneezes, fevers, headaches, but I would have to say we are definitely not at the height, and that's revealed in the numbers. The CDC estimates right now that at least 1.9 million flu illnesses have been detected, likely an undercount. Not every single person is testing, and that's also equivalent to about 10,000 hospitalizations. Diane, at the height of the flu season last year, we saw over 400,000 hospitalizations, so we're very early on in the flu season.
You've said the vaccine isn't a good match for this new strain. How's that complicating things, and is it still worth getting?
It's still worth getting. We can see in the early evidence from the UK that the flu vaccine reduces your risk of hospitalization, mainly with children and young adults, by as much as 70%, reducing the risk for hospitalization for adults as much as 30 to 40%. Still an important number that can reduce your risk, especially if you're concerned about visiting the hospital or the emergency room. We've seen mismatches happen before. Unfortunately, you cannot predict the timing of a new strain of the flu. It loves to change what it looks like, and when that happens during the summer, that increases our risk.
Everyone's getting ready for holiday gatherings now. We know those, as great as they are, can be a breeding ground for viruses like this. So what can we do to stay healthy and stop getting or spreading things if we're sick?
I was recently on the train from Boston, and I felt like it was a symphony of coughs. A lot of people are coughing, and you have to pay attention to that. When you're on a place like a train with limited ventilation, you want to grab your mask and pay attention to your surroundings, but also making sure that remembering that you know how to reduce your risk, making sure that if you can, get your flu vaccination. And also the best method that we've learned through the pandemic, washing our hands, grabbing that mask, cleaning high-touch surfaces. And also, if you have symptoms, getting tested early so that you can prevent transmitting it to another person who might be more vulnerable.
All right, ABC News medical correspondent Dr. Darian Sutton, thank you.
Of course.